Hello, I am Shelby. I will be talking about fine motor control in children with cerebral palsy. Some people may not know what cerebral palsy is. It is a problem that can affect a person's muscle tone, movement, and motor skills. It can happen in children and adults. My articles focused on unilateral cerebral palsy and hemiplegic cerebral palsy. Unilateral is a disability when one side of the body cannot function. Hemiplegic is a disability when one side of the brain is damaged and affects the opposite side of the body. So the left side of the brain is damaged, but the right side of the body does not work. Another piece of background is the participants. They were all children. Their age ranged from 3 years old to 16 years old. And it can be through any age, but mine were children. There were 290 children overall. 124 children were male, 103 were females, 72% were unilateral, and 11% were hemiplegic. Two of the articles did not specify which type or how many female or male participants there were. The summary of the results were that practice helped the child or children retain the movement memory, age, sex, weight, height. They all had no connection to the results that were found, and children with hemiplegic cerebral palsy were 10 times slower with manual dexterity, even though they matched the blocks correctly during the test. The summary of the methods are a few of the tests that were done in the articles. The first one is a Jepson-Taylor test of hand function, and it was used in 2 of the articles that I found. The test examined speed and dexterity. The children had to turn over cards, eat, pick up, and carry objects. The next test is the assessment of motor and process skills, which was used in 2 articles also. It was used to determine the ability of daily activities such as chores, meal preparation, and self-care. A few of the other tests used in the articles were the assisting hand assessment and the visual perceptual skill test. Next up is the discussion. Some of the things that the results brought to light are that children with hemiplegic cerebral palsy have an internal perception of weight for familiar objects. So when they went to lift a familiar object, the child knew how much the object would weigh and how much grip would be needed. As mentioned before, the children were able to retain and learn the movements by practice and repetition. Children with unilateral cerebral palsy were found to have a connection between muscle power, motor control, and process skills with functional outcomes. It was also found that muscle power is important to treatment and improvement of independence and self-care. Lastly is the application. One of the jobs that could work with children with cerebral palsy is a behavior specialist. To be a behavior specialist, most only need a master's degree in learning and behavior analysis. They can work in a school or even in a clinic. They help children to learn the appropriate behaviors and slowly change the bad behaviors into good. The second job that could work with children with cerebral palsy is a speech and language therapist. To be a speech and language therapist, one must have a doctorate in communication science and disorders, a master's degree in speech pathology, and certified. Again, they can work in a school setting or a hospital. Speech and language therapists teach children and adults how to improve their voice and make sounds. Thanks for listening. I hope you have a great day.